Alrighty, we're going to go ahead and get started since you all are incredibly prompt and early. Must be a Kansas thing. It's amazing. So we have a fabulous panel, and I think probably the easiest is for just to let them go through and explain to you what they're doing. But the purpose of this session, for designing sessions, was to have a panel that talks about the why broadband and the bandwidth part. So they're not going to get into numbers, but they're going to be like, okay, this is what we're doing. That means that our usage is more than it was last year or the year before. So we can understand kind of the why of the new issues. So, did you all decide who wanted to go first? All favors Kathleen.
We're gentlemen, we want the ladies to go first.
All right, Kathleen, you're up then.
Okay, so just a quick introduction. So I'm Kathleen Boyle-Dalen, Vice President of Prep KC. Prep KC is an education nonprofit here in Kansas City. We work with 5 of Kansas City's urban school districts. Those districts collectively serve over 50,000 young people, most of whom are low-income students, students of color, and first-generation college goers. And so I'll say more as we go about our work, but we work with those districts on a set of strategies to get every young person better prepared to be successful in college and in careers. And so I'll be able to talk specifically about what does our work look like in the space of helping districts utilize technology-based education programs and platforms to enhance learning for students. And we have a couple of lessons learned around use that I can share.
Hi, my name is Jody Denson, and I am a project manager with the Kansas Health Information Network, which we call KHIN. We're based out of Topeka. We're a nonprofit agency, and we work, I'll summarize very quickly, but I'll go into a little bit more detail. We work in connecting electronic medical records together to one federated system, so you can send and receive patient data. So KU Hospital can look up, their patient if they've been seen at Hayes Medical Center.
My name is David Hansen. I'm the Assistant Director of Libraries at the Kansas City, Kansas Public Library. We serve all of Wyandotte County. We are in the process of transitioning from really 1985 library to 2015 library. And the things that we are doing really are about trying to deliver content the way content gets delivered today.
And I'm Alan King. I'm the Director of Curriculum for Kansas City, Kansas Public Schools. 7 years ago, we were the first district in the metro area to implement a one-to-one laptop at the high school. And at this point, we've grown to where we're at minimum 2-to-1 of devices at the elementary and middle school, and we're growing that to 1-to-1, and we'll talk about our needs around broadband.
And then you want to start then in explaining some of the kind of what you guys do and the challenges you've encountered in lessons learned.
Sure. So I'll just share kind of an overview of the strategies that we implement and some of our lessons learned from the kind of space of tech-based strategies inside urban public education. So kind of quick, broad brush overview. I mentioned we work with 5 urban districts by state, so Kansas and Missouri, on a set of 3 strategies that are designed to better prepare every young person for college and careers. So those 3 big strategies, just to give you a sense of the context of our work. One is a strategy that we call math benchmarking. So it's a strategy for raising the level of rigor in all math classes, and probably in this room I don't need to talk about why math matters so much, but we do quite a bit of work on getting every student to a place where they can be successful in college-level math courses. Second strategy for us is an early college strategy. We have partnerships with 26 post-secondary institutions in our region, and those strategies are really about, again, helping Kansas City's urban high school students, most of whom are low-income, first-generation college goers, get prepared for their post-secondary education and start taking college courses while they're still in high school. And our third strategy, or really set of strategies, is in career readiness. So we have partnerships with over 170 businesses in our region to partner with us in Kansas City's urban school districts so that students have many more opportunities to explore high-growth careers and then prepare for those careers. And so the space where our kind of tech-related work happens is, one, in helping teachers across urban districts better utilize technology to enhance learning. So as an example, folks are probably familiar with the Khan Academy, which is a web-based learning strategy. We've been partnering with teachers to utilize Khan Academy inside our math benchmarking strategy to advance and accelerate learning specifically in math. So one place we do a lot of work in this kind of tech realm is professional development to teachers and district leaders on using tech strategies in the classroom. The other is an initiative that we call KC Tech Start, where we're partnering with 8 local businesses and 4 post-secondary institutions to create pathways into tech post-secondary degree programs and careers for Kansas City's urban high school students. And so kind of based on that work, we have probably 3 big lessons learned. So one for us would be that access does not equal implementation. So there was kind of this belief that if we just dropped technology on schools and districts, they would just magically make use of it. Our experience is we need to be pretty thoughtful about providing teachers and educators with ongoing support and professional development so that they can utilize that technology in the classroom. So we say at Prep KC and kind of talk about this idea that if you want to be high tech, you also need to be high touch, meaning you need to be providing professional development. We need to be supporting people in using that technology. Our second big lesson learned would be about the kind of access that technology can create and the way that technology has been a powerful equalizer. So we've absolutely seen in classrooms where technology is getting utilized that is leveling the playing field for students and really providing students who wouldn't have access to some experiences or materials. It's providing them with that access, and it is helping to create some equity in education. So we definitely have seen that. And I think third and finally for us, when I think about big lessons, what we tend to hear when we think about kind of growth opportunities inside this tech space, when we look at the data and the feedback that we get from teachers, what we see is that teachers are really hungry for using technology as a way to customize and individualize learning. So using technology as that tool when they recognize Alan needs something different than Angela, technology can be a great tool for providing different learning opportunities to different students. And so that's where we see definitely teachers hungry for using more technology in the classroom. Is that okay?
So I think it makes sense to follow up with Alan then.
Absolutely.
Please.
Great, because I was taking notes on some of the things she says because I can echo many of the things she says. As I said, 7 years ago we implemented one-to-one at the high school, and the fact that providing access does not equal implementation is very true. I would say on a good day we're at 75% usage of them across the high schools. On a normal day, I'd say it's closer to 50, maybe even less. That although they have the tools, doesn't necessarily mean they're getting used the way they want to. However, with that, we also see our bandwidth has been getting eaten more and more by our usage of them. We did have our technology team has been very had a future vision when they first built our infrastructure. We put in fiber when everybody else was putting in Cat5s as a backbone. And as a result, we've had a larger pipe and we've effectively used E-rate funds to build our infrastructure over the years. And now with Google coming in, we're able to utilize that, but there are also drawbacks to that too. The use of the technology with ours, I said that we're at a 1-to-1 at the high schools, 2-to-1 at the elementary and middle schools. But in reality, if you look at it, like for me, I'm at a 1-to-4, where I not only use my Mac laptop, but I also use a PC laptop where I have to do some of the business programs that only run on PC. Plus I have my tablet, plus I have my smartphone. And the idea of having more devices than you have individuals is foreign to people, yet it happens all the time. Even though at high schools our kids do one-to-one, our teachers are beginning to utilize the kids' smartphones as a way to submit surveys as a quick clicker system in doing that. Those all in time then eat up some of the bandwidth. The cloud, the use of the cloud has made a big difference. We used to store things on a local server. Now we utilize the cloud in many of our programs. As a result, there's a lot of that talking back and forth. Google Classroom has exploded as a grassroots effort in our district. It was started being made available. Teachers who are jumping on it, people who we couldn't get used to the technology before are now using the laptops with their kids, utilizing Google Classroom. But there's a lot of talking back and forth that goes on with that. Also, we have the issues of, because of issues like Sandy Hook, we have gone to high definition cameras, safety cameras in our buildings. Those cameras eat up a huge amount of bandwidth sending the information, especially for when we have a small school, elementary school that's next to a high school. We have a situation there where we can't store it at the elementary school, so it has to send it to the high school, and as a result, it's eating up a lot of the bandwidth for that high school so that they can't not effectively use it as much as they want. So all those things are changing, and you know, we were, in the next year or so, we plan to be one-to-one at the elementary schools. But at the same time, it also is becoming a 1-to-2 with the kids. We tell them to bring, we don't have to tell them to bring their smartphones. I say if we ever want to get rid of smartphones, we tell the kids they have to bring them, then they won't bring them. But otherwise, they do have them, and now that they know it's okay to bring them out, they bring them out. For kids whose laptop is taken away because of punishment or because of there's a breakage to it and they don't have a repair necessarily, a lot of the kids are pulling out their smartphones and still staying up with what's going on in the classroom. So it's amazing how these tools, and the kids are picking up so much faster than the adults are. So if we would get out of the way and let them show it, they would actually get that.
David, would you like to?
Nah, well, it's good. All right,
Follow-up.
that's a good follow-up. You almost want me back.
There we go.
I'm getting closer. You know, the public library has some very interesting things to think about. There was a guy in the plenary, the guy with the construction thing, he said, you know, if you're on a river, you had growth. If you're on a highway, you have growth, right? Those are really important things for us to think about, because from a library perspective, I want to ask you all a question. If I said, okay, I'm going to give you a free book, but you got to go drive 10 minutes, and I want you to go stand in line for another 10 minutes, and I want you to fill out an application. We're going to process it in 5. And when you get to the end of that, I am now going to put you in line, and you're going to get your book in 3 months. So how many people in this library have gotten or in this room have gotten a book out of a library in the last year? And these are my librarians. So we had a unique problem. We have 2 problems in the library, because on one hand, we have digital users who are now at price points with content where if they have broadband, and we have parts of Wyandotte County that have broadband, you might have heard some about the Google, they kind of came. We have folks who have that, and they want digital service. They love Amazon. They love Netflix, right? How many people have streamed a video in this room? Really?
You mean like this hour? Or?
Like this hour. Depending on how well we do in this presentation, you might be streaming right now. You got a password on the broadband, right? So on one hand, we had this problem of these folks who are leaving us, and they're leaving us in droves. What do? Library websites just don't work for these people. Because if you look at the places where people go to get content on the internet, they look a whole lot different than a normal library website, right? So what we had to do was come up with some way to make folks want to use the library who are digital folks. These are, and a lot of these folks have never used us before. So we came up with the idea of e-community. E-community is something that we built off of our website. It's a separate community just for those folks, just like we do story time for little people. We do e-community for the folks who are just digital. It's their own platform to use whatever they want. Part of e-community is an e-card. You can go to our site, sign up for a card. It's instantaneous access to everything that we've got digitally, except a couple of products, some of which can only be used in-house and some of which are very expensive. But for 98% of what we provide, you can have instantaneous access. But that wasn't good enough. Sorry, I sound like a commercial. Because even if I gave you an ebook and then you got all of that and then still had to wait 3 months, you're not going to like that experience because it's a digital experience, right? So we had to go out and find a bunch of products that were simultaneous access. Because as the woman says, instantaneous gratification is not quick enough for a lot of the high-end broadband users. So we created that. And we now have a platform called eCommunity that does all of those things. And it is really step one. There's a 3-step process. Because there's still value in what libraries do in terms of access to content. All we have done is created a platform that now the digital user can use. Now here's a take-home thought that we're going to talk about that may not have been at this one. When you build something and it's easy to use, you will never hear from your user. You will see that they're using it, but you don't hear from them because they figure out this stuff, right? So it's really dang difficult to figure out what you did wrong because they're already fixing the problem. That's what they are, right? So feedback mechanisms for the things you do right or the things that you build are some of the hardest things to get your head around. Now, conversely, I'll echo the other comments here. We in Wyandotte County, we have a terrible broadband penetration rate. We really do. We have huge issues. We rolled out a mobile library that's got a 6-seat computer lab in the back that's hooked up to the internet wherever we go. And we go anywhere east of 635, and if you're familiar with Wyandotte County, that's what we would call sort of the downtown region, the eastern part of the county. And that's where our challenges are. And we dropped technology, right? Opened it up, said, here you go. You probably dreamed about this. Turned out they didn't. Now we have to go back and we have to figure out ways of engaging them with these technologies because these are going to be the users of the e-community probably in 10 years. So simultaneously, we have to go figure out how to handle all of you people who've got really great access and know what you're doing digitally, while we're trying to handle people who have no access and not exactly sure why they want it. So that's really the challenge. Now, I'm going to make this offer to this room and this room only. If you go tell anybody else, I'll yank it. They can have it as well. If you want to try eCommunity, we have a way of signing you up for a temporary while you're here for the week or the day, and you want to try it out, we will sign you up and you can experience what this e-card is. What I'll tell you is what we think is that we're at the beginning of a huge inversion in public libraries. The eCommunity, the site that we built that's just for our digital users, we think actually it's going to overtake the site we have for regular users. And instead of being, in old libraries, if you go to an old library site and you look at it, you'll have all those things that'll be like this e-resources or digital resources, and you click on it and you have to go down into it. We think probably in less than 3 years, all the sites will be reversed. And it'll be the digital site, and there'll be a little tab over here to get all the old stuff that we think of as on those library sites. So.
Great, thank you. Jody, you're up.
Okay. So I'm going to talk about healthcare and IT. So we're shifting, I think, from libraries and education to healthcare. So my name's Jody Denson, and I'm with Kansas Health Information Network. And what KHIN is a health information exchange. So I'm going to do a little bit of a deep dive, although I'll watch the time, into what a health information organization is, what health information exchange is, and then hit on some statistics, partially because I like statistics, but I think when you are kind of looking at those numbers, it gives you a better sense of how many patients we're talking about, how many providers and clinics and hospitals throughout the state we're talking about, and then I'm going to wrap it into kind of the effects on bandwidth and why increased bandwidth is so necessary. So a health information organization is an entity that's created to facilitate the exchange of health information data. So the exchange of data from a hospital to a clinic, or let's say you have a patient who shows up in the doctor's office in the morning, short of breath, blood pressure's through the roof, and the doctor says, you need to go get admitted into the hospital immediately. Well, so the patient does, and the hospital can look into the health information organization's exchange and see exactly what happened to that patient in the morning, what that patient's history is, what has happened to them at that doctor's office for the past 3 months. Or if you have a patient that shows up in the emergency room, and I always give myself as an example because I'm extremely allergic to penicillin, deathly allergic to penicillin. And for years, I've had to tell my husband and my family members, if anything happens to me, please tell the emergency room, no penicillin. So with Health Information Exchange, an ER doc can log into our system, pull up my name, and automatically see what I have allergies to, what medications, what food I have allergies to, thereby, in my instance, potentially saving my life. So that's kind of Health Information Exchange and how it's used. So it's securely, electronically transmitted data from one provider's office, from one electronic medical record actually to our system. And so the objective is to improve safety, to improve quality, to improve care coordination for patients. And kind of how, another way I compare it to is it's like if you're using a cell phone. So if you've got a cell phone and you want to talk to someone else with a cell phone to make that connection, you need to subscribe to Sprint or AT&T, so you can make that connection. So KHIN is like Sprint or AT&T. If a hospital or clinic connects to us, they can not only send their patient data into the exchange, but they can also receive patient data from other clinics or hospitals. So we make that connection for them. Okay, and so it helps with transitions of care, like I was just talking about when a patient needs to go into the hospital. It helps with patient engagement, so the provider is really up to date on what's happening with that patient when they come into the provider's office. And I think one of the really interesting things is that it helps with public and population health. And so I'll give you an example. One of the groups that I work with is Wyandotte County Health Department. And one of the reasons they're using it is to track public health and to track disease outbreak. And so they can log into KHIN and kind of monitor, where patient A is going, what's happening with a couple of patients they're concerned about, and monitor potential, outbreaks across the state. So measles, mumps outbreaks, you can kind of track those outbreaks. And so a lot of health departments are getting involved in Health Information Exchange for that purpose. So then a little bit about KHIN. As Kansas folks, I want you all to kind of understand how we were created. So we're a nonprofit agency. We're based out of Topeka. We were created by the Kansas Hospital Association and the Kansas Medical Society, and we're regulated by the Kansas Department of Health and Environment. So we're not kind of out there on our own, doing our own thing. We're regulated by KDHE. And then into my statistics, which I like. I don't have too many. But we have, to kind of give you a scope, a sense of KHIN, we have over 2 million patients, unique patients in the exchange. So 2 million patients, you can access their medical information. But we have access to over 5 million patient charts. So a patient that's showing up repeatedly in different places, 5 million pieces of information on them. We have over 880 members throughout the state. So when I say members, I mean anything from mental health departments, public health, small clinics, and big hospitals. So we kind of cover any sort of healthcare organization. We have over 100 organizations in production, and what that means is they're actively sending data into KHIN. And so what we do is we work with their electronic medical record vendor. So I know you guys go into your doctor's office, and all the providers and nurses are at the computers these days. Hardly anyone has paper charts anymore. So that's their electronic medical record. And so we work with the EMR vendor to build an interface connection between the electronic medical record and KHIN in order to take their data in. And so we build a secure and encrypted tunnel to take that data. We connect over VPN and TLS for you tech folks in the audience if you're interested. We have about 30,000 queries a month. So by queries, I mean providers, clinical staff logging into KHIN and looking at patients, 30,000 a month, with spikes of up to 100,000 a month. So I'm kind of mentioning that in terms of bandwidth when you think about 30,000 queries and 100,000 spikes. And then for public health transmissions, we send 1.5 million transmissions to syndromic surveillance. We send over 130 transmissions to the immunization registry, which is Kansas WebIZ. The importance of kind of sending that information to WebIZ is, sometimes we find that kids are getting under or over immunized, because if you have a mom showing up with 5 kids, how is she, it's so hard to keep track of, I don't even know what I've been immunized for. So when we have hospitals and clinics sending their data through KHIN to Kansas WebIZ, it comes into Kansas WebIZ, it comes into KHIN. So you can better track the immunizations for the kids. And then we also have so the provider portal has full HIE query functionality, and it's web-based access. We also have a patient portal for patients to log into, separate from the provider portal, where it's a statewide portal. So I know when you go to the doctor's office, you're going to the doctor's office, you're going to the dentist office, you've got your insurance company, you've got your hospital, all giving you information about their patient portal. And so what KHIN has is a statewide one, where all of the providers, the different providers, can send you information as a patient to one portal, so you don't have to keep remembering your passwords to all these different portals. And so that, again, is kind of when you're thinking in terms of bandwidth, patients logging in and trying to access their health information. And then we have state level interfaces. So we interface with Kansas WebIZ, syndromic surveillance, reportable diseases, the cancer registry, and the infectious disease registry. We also have alerts. So if a provider wants to track when their patient is showing up in the ER, or when they're in the hospital and they're making rounds on that patient, a provider can get an alert as to what's going on with their patient. And then KHIN is a federated system. And so I'm not quite sure how techie to get here. Maybe it's interesting to some and it's a bore to others. But a federated system is relevant in terms of bandwidth because it's a type of metadatabase management system which transparently maps multiple database systems into a singular federated database. And so the provider's databases are interconnected via a computer network. The provider's databases can be geographically disparate. So from Kansas City to Parsons and Garden City and Hayes, all of these systems are connecting into one. Okay, and so a federated setup requires a greater network bandwidth than other approaches. And so that's kind of what's happening in Kansas, is that federated system to connect all of the databases together. And so there are a wide variety of doctors and hospitals querying in Kansas that weren't before. And so even 2 years ago, we've added millions of patients into the exchange. We've added over 100 doctors and providers querying. So if you can, even a year ago from that. And so we keep growing each year. And actually Kansas, in this health information exchange, so there's health information exchanges across the country. Each state has one. Some states have multiple exchanges. Kansas is the biggest health information exchange in the country. And so by biggest, I mean we have the most hospitals and clinics sending us data. And you can just imagine kind of the growth on that. And I know with my job, so I'm a project manager and I connect those clinics and hospitals into KHIN. I'm on my computer, 9 hours a day, and I notice come 3 p.m., my internet slows way down. And I sometimes, I'm in Kansas City, in Roland Park. I sometimes will lose my connection when I'm looking in KHIN to query patients. And so that when 3 p.m. rolls around, I try not to schedule, any kind of demos and webinars because I know things are going to slow way down. So let's see, if I wanted to hit on just kind of a couple of other things. One of the things that I was looking up, and I was thinking about bandwidth, and I was thinking, I travel across the state. And so I work with, I go everywhere, Coffeyville, Russell, Hayes, I go to Garden City a lot. And what I've found is that the smaller towns, to me, the smaller towns seem, and when I say towns, I mean the clinics and health departments and mental health centers, seem much more interested in getting connected to KHIN than some of the larger cities. And I think why the reason that is for instance, let's take Hutchinson. So Hutchinson clinics have their own connection to the Hutchinson hospitals, and so the Hutchinson clinics really just refer back and forth with hospitals and clinics. But when you get out into Garden City and Parsons and Coffeyville, they're those guys are sending up into Kansas City, and they're sending a lot of kiddos at the Children's Mercy Hospital in Kansas City, and they're not connected in any way. Garden City is sending a lot of folks either down into Oklahoma, to Colorado, or kind of up into Hayes. And so they are really interested in connecting to KHIN because they don't have that quick access. And so when you think about usage and who's really using kind of KHIN and that bandwidth in Kansas, My experience is that it's more in the smaller towns, which I think is interesting. You would think for some reason it's in the bigger towns, but it's not. KHAN's also is getting ready to connect to the system in Colorado, so that's going to increase our usage even more. We're connected to Lacey, which is an exchange that's kind of in northeast Kansas and northwest Missouri. And then we're getting ready to connect into the Missouri system. And so in Kansas City, we have so many folks crossing the state line, for healthcare purposes. And so you'll be able to read that data back and forth. And so that's just kind of been my experience in where I think the need is, who I think benefits most from using KHAN and looking and seeing medical representations.
That's fabulous, thank you. Questions for our panelists? We made sure to factor in lots of time for discussion amongst you all and the panelists. Okay, I'll get us rolling then. What happens at 3 o'clock?
What happens at 3 o'clock? So I'll actually give you a literal example that it makes me crazy. So I'm logged into KHAN, so it's that web-based portal, and I'm on a webinar and I'm training, someone so far away, taking 6 hours to travel to them. So we do webinars sometimes. And I have test patients that I search for. So when I can plug in a test patient, I can show them this is what their meds are going to look like. This is what their allergies are going to look like. Here's what a visit from a hospital would look like. And so I type in the test patient and I hit search and it spins and spins and spins and spins. And sometimes it'll pop me out, log me out. Sometimes it just spins and spins and spins. And when you have either a patient in a doctor's office waiting for that doctor to gather that information, or you have someone showing up into an ER and an ER doctor is logging into KHAN to look up that information, you can't afford to spin and spin and spin and spin.
Is that because the final bell?
Oh, it's
Because
kids.
our
It's
kids are out of
kids.
school.
Right.
Yeah.
It's Netflix streaming,
your fault.
and
It's really all Alan's.
Alan, if you could fix that.
You need a 2 terabyte connection there.
Yes.
That's great, thank you.
Just to clarify, are you sure it's the internet and not a reporting program running against the database? Because
Yeah.
sometimes they schedule them inappropriately.
Yes, and good point, And I know it is because I hear the same thing from other people that are using our system or are, teaching a class using, I use ReadyTalk all the time. Even my ReadyTalk will slow down, so, but good point.
Other questions? Kathy.
I want to hear more about e-community.
All right, let's hear some more about each community.
More.
Yeah, what all do you have
Oh.
when you get in? And
Can I pass these out?
Yeah, you can pass those out. The pieces go exactly like you would imagine a library piece to go. There is a lifelong reading component, and unfortunately for us, that really comes down to audiobooks. There are 2 major places that we get audiobooks that are simultaneous access. There's a product called Hoopla, which is widely available in the consortiums here in Kansas. Your local library probably has it. And there's one called One Click Digital. One Click Digital has older stuff, however, it also has a Spanish language collection. And one of the things that we're very interested in is getting materials in other languages because that's one of the things to do. It also then provides simultaneous access to all the databases. And the state of Kansas has some fabulous databases. And one of the great things is Learning Express. And in talking with, when you talk about Learning Express, one of the things that we talk with educators about, so I put off my paper until Sunday at 6 p.m. Library's closed. If I don't have a library card right now, there's no way I'm getting in any databases doing work, unless it's school databases. I may not need those school databases. So what am I going to do? Well, I can get absolute simultaneous access to all the databases that I have in my system right then, right now, to do those things. The other thing is very interesting. I don't really like anecdotal evidence, but this was kind of a fun thing that when we opened it up. I had an employee who's got a daughter in her 20s, and we had been talking. She's looking for a job, and Learning Express has a lot of certification type data. But want to be a CDL, want to be a hairdresser, want to be all these kinds of things. This woman had literally been on her knees begging this girl to come in, sign up for a card so that she could then do this thing. The minute she heard that she could sign up online and get instantaneous, well then of course it was real. And of course, they're going to do that now. I think that the biggest issues that we have, the things that we had to accept when we did e-community from a public library perspective, this was a really odd thing. It's not hard to give access. It's hard to give up the things that you used to do to hold on to provide access. You used to give, if you went in to get a library card, you come in, you have a driver's license, we verify all these things. Now here's the deal, folks. The reason we verify those things are for two reasons. One, we want to make sure that you're somebody we should be giving service to because it's tax dollars, right? And number two, and this is the primary reason we take all the information, is if you don't bring our stuff back, we're going to come after you to get it back, and there are chargeable fine events that occur if you don't bring it back on time. It's famous Seinfeld book cop, right? So this is the reason we need all this information. Now, if you step back and understand what digital e-content is, it's impossible. You can't lose it. Your dog cannot eat the e-copy of whatever you're looking at. You just can't do it. You cannot create a financial transaction. And once you get over the fact that you don't need to know all of that stuff, that really what you have to do is you have to reasonably establish that this patron should get services. It is no different. I always explain it, because trust me, when we walked through this, I had like half of my team at the table hanging on with white knuckles going, you are not really going to do this, right? And I said, look, I could have somebody from Denver for Pete's sakes, walk into a Kansas City library wearing a Peyton Manning jersey, and they can use all of our reference books. They can get a guest pass, sit down at our computers, use all of our electronic resources if they want. But you're telling me that if I reasonably establish that this person should be getting services, you need more than what I'm going to give a Peyton Manning loving Denver Bronco fan? Seriously? Once you get past that, the provision of e-content becomes a whole lot easier. Then it really becomes on you to figure out the simultaneous access.
Is your e-card, then, can they bring that, if they want to physically
Yeah.
walk in, they can use that then?
If they want to come in and use the library and get traditional content,
Okay,
we call it traditional content because it's, I don't know, sounds like you're going to Weston, Missouri. Traditional content. You come in and you actually have to transition to a real card.
Okay, so the
because then
e-card
you
is
can
just
create
for online.
bills that I may be wanting to talk to you about. But,
You may already have 3 cards.
you know, and a lot of, we talked a lot about, well, what if somebody has too many cards?
Yeah.
And I'm like, no, we work very hard to make sure everybody plays by the rules. And we're 98% sure we're going to be good about that. The thing that I always tell people is that we're about access. And if we're good 98% of the time, that 2% is okay with me. Because really, if we're erring on the side of access, we're doing what we're supposed to do for the citizens that we serve. So it's not hard, by the way.
So do you validate where the people are from for the electronic resources?
Okay, I'm going to tell you the secret. But if you tell anybody, right? We validate on zip code. We looked at everything, right? And the thing was, we thought about validating on street address. But it turns out everybody writes different things for street address. Somebody writes terrace, T-E-R-R-A-A. There's too many variables. And again, it's about access. So when you fill out your deal, so long as you have a zip code that we serve, you will get a card. See, now the evil part of your heart has kicked in, so that you know. And like I said, about 2% of the people are going to do exactly what I'm in
It's
Jacksonville,
just for
Florida.
educational purposes.
This is true. But that's really what we do. And so far we found very little, people, in fact, we had this product called Hoopla, and in almost all the products that libraries use now, you have to register twice. So you verify off of the database that you have, and then you create a user account and a password. And we found that that second password was a barrier to access. And again, sitting around a table, everybody white knuckle, I said, take the password out. They know their deal, just take the password out. We verify, right? This is about access. dropped our failure rate of people logging in amazing. Because evidently people can't remember that much these days. Alan, you need to fix that.
So they ask us what their password is.
They keep them all written
But,
down
you
in
know,
the
they try to-
notebook,
so-
and they lose.
You know, once, and again, once you played it, and we used to go back and we talk about how does Facebook verify people? You know, how does Facebook verify you are who you are? I don't know, I don't think they do a whole lot of a background check. I'm sure Pinterest does, I'm sure Twitter doesn't. But this is, you know, if you're gonna drive on the interstate of broadband, these are you know, it's kind of like, if you go back to that analogy the guy in the plenary said, if I'm gonna try to build Main Street in the middle of I-70, bad things are gonna happen. That I have to build things if I'm gonna live on I-70 that look like they belong on I-70.
I have a question for Jody. Privacy. And if you're exchanging data with multiple different groups, and how are you identifying that the data that you have, for example, you with your allergies toward penicillin, and if you are sick in an emergency room that is not, how would they know it's you?
Right.
What are you using for privacy?
Right, good question. So we have a patient matching system built into KHIN. And for example, so we match on first and last name, date of birth, and gender. And so another example, KU, they use an EMR system called Epic. And so Epic has decided that they want even more stringent matching than first, last name, and date of birth. It has to be zip code or city or, you know, a few other items. So you can add on as many matches as you want, but we do on that. And then if we were to have, say, 2 people show up, which we never do, but it'll match on one. You know, you click on that patient, and then you see the demographics on the patient. You see the age, you see it matches up, it's the correct match, and you know it's the right one.
Okay, another question then, you mentioned immunization. What's the potential of possibly providing access to schools so that when you mentioned parents not knowing what immunization the child has, that if the school could have access then and have that online?
Right, I think that's a great point, and it's one we're working through. You know, kind of what we're butting up against is it has to be for the care of, you can be a member of KHIN if it's for the care of a patient. And so we're thinking of working with schools and allowing that nurse, that school nurse, to be the only one with access, not teachers, not principals, just that school nurse. So we're working through that. We know that's a need, definitely.
That's a great question.
I have a question. I have a couple, but so several of you with KCK, so you referenced Google, Fiber, and Broadband, but Alan, I was kind of interested in you made a comment, but then you didn't really expand upon it. There were some benefits of that, but then there were some drawbacks. I don't know if you want to expand.
Well, the drawbacks are that it's been slow to get in, and it's to run the proper firewalls to it, we had to buy new firewalls, and so it's expensive getting it in. I think once we get it, it's going to be great. But it's just slow implementing it right now. I do not believe any of our high schools have it. We've got it in 6 buildings right now, and I believe Argentina is one of those schools, is that right? Yeah, so Argentina. And it's, no, I've heard from, nothing specific, but I've heard from different people that they do notice the difference. One teacher said she didn't, she said things still buffer, and I told her to get off Netflix, and she said, no problem. I said that jokingly, but yeah. But, yeah, I mean, Google's really, it's just slow. I think, you know, everyone's, oh, Google's coming, and we'll be right there. And it's just a slow process getting there.
So then my other question, sorry.
No, please go ahead.
The KHIN, sorry.
Jody.
Sorry, Jody. So in terms of the access, you're talking about the different hospitals and clinics. I mean, is it pretty much broadband access? I mean, or are you guys using what for all the access?
So do you mean for a hospital or clinic to access KHIN?
Well, actually, just like the connectivity, so broadband speeds, connectivity. What are you? It sounded like you were the project manager to kind of facilitate that. You mentioned 800 and some locations. So just, those are probably all set up, but yeah, what speeds are they on now? Are you looking to increase speeds and all that kind of stuff?
Right, so from on the KHEN end of things, we're not looking to increase speeds. Sometimes I see the clinics need to do some server upgrades because it kind of can overwhelm their servers. But that doesn't happen so much. I think where the main concern is that the clinics or hospitals logging into KHEN to view that data. And so they could technically log in even through dial-up. It would take them forever. And if they want to look at any images, that's that'll take forever too. But from the KHEN point of view.
So are they responsible, I guess that's maybe a better question, are they responsible for acquiring that speed or that access, or do you facilitate, you being KHEN, facilitate that?
Yeah, so they're required, if their servers need to be upgraded, they're required to do that. We wouldn't facilitate that or do that for them. But really, it's just us kind of building that interface that sits on top of it, kind of sits on top of their EMR. We build this secure encrypted tunnel, so that VPN tunnel connection basically, and we send the data through there. And that doesn't require a certain amount of bandwidth to do. I'm not sure if I'm answering your question or not.
Well, I guess what I'm saying is if they had just, you mentioned dial-up, so let's just say they had some simple dial-up connection at their hospital or clinic and they needed an upgrade. So they are responsible in getting that pipe, so to speak.
And they have
upgraded.
other needs too, right? Like this is just one little piece of their broadband needs.
Yeah, it's one piece. But I will say, KDHE has been great about, they have been writing federal grants to get grant dollars in for clinics that can't cover these costs, as long as they start to send immunizations through KDHE to WebIZ. And sometimes these grants have been, for an individual clinic, up to $30,000 to pay for the technology costs for this. So I understand where you're getting at. Those clinics, sometimes don't have the funding to do that, but.
Anyone else? Yes, go ahead.
Jody, what does the HIPAA have to say about the transmission of electronic health record data over the internet? I mean, obviously it has to be encrypted. How specific is it about what technologies are used or that kind of thing?
Gosh, that's a good question, and one that I'm not sure I can quite answer is from how encrypted it needs to be. I know that to be a health information exchange, you have to be certified by the feds, and so there's very stringent requirements that we need to go to, even to use, and I didn't really touch on this, but we also have direct messaging, which most health information organizations do, which is secure and encrypted email. It's kind of the encrypted email of all emails. It's direct to direct. So if you were to send like a direct message to someone's Gmail account, they would open it up, they couldn't read it. And so you have to be direct trust certified is kind of the terminology for it. And then other entities, generally kind of the accepted way to do things is other entities that have direct will not connect to you unless you're direct trust certified. So there's kind of these federal regulations in place that we follow also.
What branch of the federal government regulates that stuff?
It's the ONC, the Office of the National Coordinator.
So Alan, I had a follow-on question to the Google discussion, and you had mentioned high-definition security cameras, and how are you seeing those cameras and bandwidth that they require affect those connections?
I can actually give you a number here. I was asking our IT folks today about it, and I asked on overhead, which I would consider, our voice over IP and our high-def cameras. And at peak points, they can be up to 75% of our current bandwidth, which is about 1 gigabyte in the buildings. So so it's eating up quite a bit.
So would that, to make sure I understand that statistic, would that be 75% of the 1 gigabit?
Right.
Okay.
So that's obviously prior to Google, coming in. According to our IT department, there's been no problem with that in Google. Schools back to the one.
Anyone else?
Are the cameras motion only activated, or are they on all the time?
On all the time.
Yeah, quite a hit on your bandwidth.
Yeah.
Even at night?
Mm-hmm.